Hi everyone, myself Dr. Mohsin Syed, MBBS MD Pathology. Today I'm back with another video in which we'll be discussing the difference between CML and Leukemoid reaction based on scattergram. We'll be proceeding in the following heads. First, we will be discussing Leukemoid reaction in brief, then we'll discuss CML and its phases, then we'll come to the actual topic which is CML versus Leukemoid reaction. Now, what is leukemoid reaction? Whenever you'll come across this word that is oid in pathology, it means like. So leukemoid means leukemia-like. That is, it is actually not a leukemia, but it will mimic a leukemia. And the leukemia which it mimics is chronic myeloid leukemia. And the leukemoid reaction occurs due to hemorrhage, drugs, infections, or rarely paraneoplastic phenomenon. The WBC count of the patient is usually up to 50,000, but it can go up to 1 lakh as well. The WBC findings on peripheral smear is you'll see left shift. That is, you'll see band forms, promyelocytes, myelocytes, metamyelocytes. Very rarely you'll encounter blast, but if blasts are seen, it is usually less than 5%. The WBC shows toxic granulations and there is no basophilia. Please note there is no basophilia in leukemoid reaction. Now we'll see scattergram of leukemoid reaction. But before that, I would like to brush up the normal scattergram which we had seen in the previous video. To study normal scattergram, there are two main entities which we should focus on. First is forward scatter, which is directly proportional to cell size and cell volume. And the next is side scatter, which is directly proportional to complexity or granularity of the cell. So on x-axis there is side scatter and on y-axis there is forward scatter. We can see lymphocyte is close to the origin because lymphocyte has the smallest size and no granules, therefore very low forward and side scatter. Monocyte has the largest size, therefore it has very high forward scatter but very less side scatter because it has no granules. Neutrophils has numerous granules, therefore high side scatter compared to monocyte. Eosinophils has dense coarse granules and which are very much in number, therefore very high side scatter. Now you'll be wondering where are basophils? Basophil will fall in this region. There is very close to neutrophils. Now you'll be wondering that basophils have coarse granules, then why there is less side scatter for basophils. There are three reasons to it. First, the granules of basophil absorb more light rather than scattering. Secondly, the reagents used in the counter causes degranulation of the basophils. Thirdly, the granules of basophils, I agree they are coarse, but they are less in number compared to neutrophils and eosinophils. That is why they show less side scatter compared to neutrophils and eosinophils. Now, keeping these things in mind, let's see the scattergram of leukemoid reaction. As you can see here, there is prominent immature granulocyte region here. This indicates the left shift of the patient, which you'll see in the smear. There is increase in neutrophil count. So if you'll ask the history, there will be probably history of any infection or inflammation going on in the body. Here we are seeing lymphocytes and here are monocytes. Please note there is no basophil here, no basophil here. I hope this is clear to everyone. Please keep this scattergram in mind when we are seeing CML. Now coming to CML and its phases. CML, it is a type of myeloproliferative neoplasm. The patients usually have massive splenomegaly. The total leukocyte count in such cases is usually up to 50, is usually more than 50,000 and can go up to 5 lakhs as well. The findings on the peripheral smear is you'll see blasts, that is myeloblasts or monoblast or any blast of the myeloid lineage. You'll see left shift as well, that is promyelocyte, myelocyte, metamyelocyte, band forms, neutrophils, and there is basophilia. Please remember there is basophilia in CML but not in leukemoid reaction. Now, scattergram of CML. So before proceeding to the scattergram, if you have read the latest WHO, has divided CML only in two phases, whereas the previous WHO has divided CML into three phases. Previous three phases were blast phase, accelerated phase, and chronic phase, whereas the latest WHO has divided CML only in two phases, that is chronic phase and blast phase. So I'll show you the scattergram in which how a malignancy proceeds, that is how CML proceeds from chronic phase to blast phase. So this is a scattergram showing CML chronic phase. So here you can see prominent basophil region. Here you can see prominent immature granulocyte region. Here there are immature neutrophilic precursors as well, eosinophilic precursors as well. Now, if not treated, the malignancy grows or increases. That is, the cell continues to multiply. And what we are seeing is another peak here. This peak is of blasts. You see immature granulocyte region has widened, basophil region has also widened, and we are seeing here blast. And if you have seen my previous video, you'll remember there are two blasts which show high SFL. One is monoblast, other is lymphoblast. So this probably is monoblast, which we are seeing the events with high SFL. Now, if not treated, the malignancy further proceeds and there is very high, very increased width of the blast here because the blast count has increased and increase in and events with high SFL, that is more of monoblast. And here you can see prominent basophilic region. So I hope this scattergram is clear, that is CML chronic phase, then further progression into blast phase. Now coming to everybody's dilemma, whenever you'll ask any resident how do you differentiate CML chronic phase on leukemoid reaction based on scattergram, they go like what I've studied, what I had read the night before, why am I not remembering? So I'm here to ease all these problems. I hope this will be helpful. So seeing chronic CML CP versus leukemoid reaction. Please note here you are seeing prominent basophil region, but here there is no prominent basophil region. Here you are seeing prominent immature granulocytic region, which is widened. Here the width is not so much because the count here is less and the count here is more. It can range up to 5 lakhs. This usually is up to 50,000, at times can go up to 1 lakh. So please keep these two scattergram in mind whenever you're thinking of CML chronic phase versus leukemoid reaction. What I found in an institute was a case with total leukocyte count of 4,92,000. So we had seen the peripheral smear of the patient. I'll highlight few images from it. So the first image here shows two blasts. You can see they are highlighted in red circles. They have prominent nucleoli as well. The another image shows two cells highlighted in yellow circle, which are the basophils, right? And the another cell which is highlighted here, it shows promyelocyte. And please note that other cells which are in the background, some are myelocytes, some are metamyelocytes, some are band formed, some are neutrophils. So to conclude all this image in one line, I would say there are variety of cells seen, right? A variety of cells. The variety of cells which are seen on the peripheral smear of this patient, it gives the appearance of a college girl appearance. Like in college girl, there are different girls wearing different types of outfits, right? Which are eye-catching. So similarly, like the peripheral smear in this case. So it is a trick to remember that variety of cells when you see. So it gives college girl appearance. So we thought this of to be CML case, CML chronic phase. We thought let us look at the scattergram as well. So when we saw the scattergram, our scattergram exactly matched the scattergram which I had shown you before. That is prominent immature granulocyte region. Here you are seeing prominent immature granulocyte region. Here is prominent basophil region. Here also we can see prominent basophil region. So when our findings correlated, we were like, yes, finally we have found something which has correlated as well. So this proves that while you are seeing the smear, you just do not see the smear, you see the graphs as well, scattergram, histogram. So it will give you a bit of assurance, bit of confidence that whatever you're reporting or whatever you're seeing is matching, whatever is there in your head is matching whatever you're seeing on the smear also. So I hope you find this topic helpful. If you find this helpful, please feel free to like, share, comment, and subscribe. Comment on the topics which you want me to cover in my upcoming videos. Thank you so much.